And so I'm happy now to introduce LJ Baylis of Community Connections at Findley Lake in New York to offer commentary at this point in today's program.
Ready to go? Okay.
All set.
Thanks, Emily. Thank you, Emily, and good morning to everyone. My name is Lynn. I'm the executive director of a small rural village in Findley Lake, New York. It's extreme southwest corner of New York State, and we're about 2 miles from the Pennsylvania border. We are a hamlet that has grown into a village within the town of Mina. Needless to say, when we a village, it kind of created some confusion initially. Our population is 154, and our median age is 59.5. The town of Mina has a population of 928, and 367 of those are over the age of 60. We are located in a community center, which is a repurposed elementary school. As a village-to-village ambassador, we were asked to write a commentary about our village and why research is needed to give us all a bigger voice. So here it goes. I am one of 3 founding members of our village, which began in 2013. Our town doesn't have a pharmacy. We don't have medical offices. We don't have a grocery store. And we knew many of our elders needed those services and many others that were difficult to access. So we bought the book put out by Beacon Hill Village and used it as a guide to set up our own rural village. And we knew from the beginning that keeping track of all the services we were about to offer, all the people that access the services, was going to be important to document. Sorry. So we started doing that. We marked every service. And we had clipboards all over our office. Eventually, we were able to afford a software database system, and we began a more accurate and consistent record of our services. Unbeknownst to us then, this was actually the beginning of our documentation for future research. In 2019, we were awarded a 5-year, $100,000 grant from New York State Office for Aging. This was a NORC grant, and that is a naturally occurring retirement community. We were one of only 2 rural villages in all of New York State to receive this award. And I think there were 2 main reasons for that. One, we were already partners with our local county AAA. And 2, and probably more importantly, our data was well organized and comprehensive. And we continue to seek outside partnerships with organizations. And our latest partner is the Univera Healthcare Insurance Company, who gave us a Health Equity Innovation Award recently. In 2017, New York became the first state in the country to enroll in the ARP network for age-friendly communities. Subsequently, New York State developed a master plan on aging. And when this type of planning comes from the government, there will be money to follow. It may be a little, it may be a lot. But who is this funding going to go to? It will go to those who have the most and the best data to support their grant requests. We instinctively know we're a bridge between social care and healthcare. We instinctively know we make a huge difference in people's lives, and we know how to interact with and care about our people. How do we prove it? We prove our value by using the government's own language, and that's data, graphs, and whatever else it takes to prove what we already know. Research isn't easy, but this is our time. If the Surgeon General can link social isolation and loneliness to a physical ailment, citing 325 references, I'm sure research could do the same for our villages. We're on the ground floor, as this type of research has not been done before, and it will go much easier if we have a united voice. It will be more far-reaching. Our local United Way slogan is United We Can. I believe if we use that same slogan, it applies to us too. We need to raise our voices, and I think that research will be the one way that we can be heard. Thank you.